Hello, and welcome to another episode of Healthy Perspectives. My name is Vernon Solomon. On past episodes of this program, you've heard us speak about different types of diseases. Diseases such as hypertension, diabetes, sickle cell, and even HIV. However, there's another disease I'd like to introduce you to, which you may not even consider to be a disease. That disease? It's trauma. Why do we consider trauma to be a disease? Well, when you're suffering from a disease, your body's normal functions become damaged or interrupted. Your body then starts to manifest certain signs and symptoms that help to identify what the problem may be. When you suffer a traumatic injury, that's exactly what happens. Your body is injured and normal functions become interrupted. And just like all other common diseases, unique signs and symptoms will typically become very clear. These signs and symptoms will help to identify what the injuries are associated with the trauma. Hence, we give it the classification of a disease. Just like so many of the other commonly known diseases, trauma too is a non-discriminate disease. It affects persons of all ages, regardless of race, ethnicity, or even gender. Unfortunately, it too has a staggering impact on a person's overall life expectancy. Traumatic injuries, they're not isolated only to first world or developed nations either. It affects us here in the Caribbean just as well. Injuries are literally felt in every corner of the planet. The World Health Organization and the American Centers for Disease Control and Prevention actually suggest that injuries account for more than 5.8 million deaths worldwide every year. There's a small caveat to this though. While millions die from their injuries, millions more are injured and left disabled for the rest of their lives. In the case of this disease, the intervention of choice is prevention. Prevention is best supported, though, through education. So, in our efforts to raise awareness and educate persons to this, yet another deadly disease, I recently caught up with Dr. Maria Jimenez, trauma surgeon and Caribbean and South America's region chief for the American College of Surgeons Committee in Trauma. We spoke about the development of interventions that have the potential to reduce the impact and incidence of trauma across a wide spectrum of groups, as well as mechanisms that can help or that should be implemented to help strengthen a nation's capacity to care for its injured citizens. So we're here today in Heritage Key. I'm sitting with Dr. Maria Jimenez from Bogota, Colombia. She's a trauma surgeon. But first, let me ask you, how are you enjoying your visit to Antigua?
Oh, I'm enjoying a lot. This is my first time here, and I find out that people are really, really friendly here. They smile a lot.
Right.
Right, more and more than in Colombia, let me tell you. And probably from many, many places in the world. So I'm enjoying my stay here. I'm
Excellent.
very happy.
Excellent. So hopefully this won't be your last time to Antigua.
Oh, no, I hope not.
I hope not. But let me ask you this, what brings you to Antigua?
Okay, so the American College of Surgeons, who's a surgical society in the States, wants to promote some programs in all over the region. It means all the Caribbean, South America, because trauma, let's say it's for you to understand people that get injured, they have motor vehicle accidents. There is a lot of problems with that, and they want to promote programs that can decrease the mortality, and they want to have better outcomes for these patients.
Are we finding that the outcomes have been poor as it pertains to trauma in not just here in the Caribbean, but in Latin America and the world in general?
Yes, especially because in the States, when they started to do the programs for, from the American College of Surgeons, let's say prevention, giving more strong pre-hospital care, educating the doctors who are going to take the care of the patients in the emergency room and looking for better rehabilitation, they found out that the mortality decreased in 25%. So this is very, very important. So that's why the American College of Surgeons wants to replicate these situations all over the world and in Caribbean and South America.
In that such importance is being placed, how does trauma fall on the scale of causes of death among individuals? the world over?
Okay, so let's say right now, worldwide, trauma is the 9th cause of death. But there is a study from the World Health Organization who's telling us that trauma is going to become the 3rd cause of death. So it's going to be very, very a key issue for the next 20 years. And if we don't do something, we cannot stop this trend. So people are going to start, and probably your grandkids are going to start to die because of trauma. Let's say motor vehicle accidents, falls, injuries, homicides, suicides, and then we need to stop that.
But many times we look at trauma as just being the motor vehicle accident. So there's a misconception there that the only trauma that you can encounter is from a car crash.
Oh yes, there is a lot of misconception, but let's say, and also there is another issue there, because people think everything that there is an injury, there is an accident.
But are there other programs that need to be focused on as well, or just the physician programs will help decrease the outcomes?
No, we need to look at this as a system, and we need to take care not only of the physicians, but especially also with the people who take care of the pre-hospital care. So if we don't have a good and a strong pre-hospital program, we are not going to be able to do what needs to be done. So let's say for trauma, there is a golden hour. So this is the time of the opportunity that when you take a patient who has an injury, you can do something that can decrease the mortality of this person. So if we don't bring the patient right away and in the correct manner to the hospitals, we are going to be in trouble.
So let me ask you this, being specific here, as a trauma surgeon, you're down in the emergency department, there's a patient that comes in. What do you expect from the pre-hospital personnel, the EMTs, the paramedics that bring that patient in? What would you expect from them?
Okay, so first of all, I would like to receive a call telling me that this kind of patient is going to arrive.
Okay.
So they need to give me some information about the mechanism and also something about the physiological status that he's on. So then, at the moment that I'm going to receive the patient, they need to give me some information too, and they need to give me about his heart rate,
okay,
and tension, to know what is going on and how can I make something to this patient.
So basically, they should be reporting to you information so that when you receive it, you've got a plan already in your head to proceed.
Yes.
Which is good. Now, are there things that you may expect them to have already done before the patient has arrived to the hospital?
Oh yes, there is not only to bring the patient and give the information, so they need to do some kind of procedures. Let's say they need to have a correct immobilization, they need to have oxygen mask, and also in some cases, if it's possible, they need to have an IV fluid to bring him some fluids, and also they need to take care of the airway, because if somebody has a problem with the airway, this person can die very quickly.
What systems do you have in place to ensure that the pre-hospital personnel have followed your instructions so that when the patient arrives to the hospital, you can engage your plan? So what systems do you have in place?
Oh, so I'm going to give you an example from my country,
okay,
from Colombia. So from the past 15 years, there has been a lot of, at least 3 people who have been doing a great job. So they have been teaching and giving information such as the PHTLS, so the pre-hospital trauma life support for all the people who are going to take care in the ambulances and all the pre-hospital personnel. So they have this information, and then they know how to deal with this kind of patients. So they can treat them well and bring them in a secure manner to the hospital.
So that's one program that then helps to support what the physician has done, is the PHTLS, or
Yes.
pre-hospital trauma life support.
Yes, that's correct.
So that's one mechanism. Now, you're in the hospital, you're
Okay.
in the emergency department. Who else helps you?
Oh, okay. So this is a teamwork. We don't work alone. If we don't teach also the nurses, if we don't teach the hospital people who take decisions, if we don't teach the people who are going to take the radiology
The X-rays.
X-rays and also the laboratory, we are not going to have all the things that we need to do to treat a good patient. So that's why it's also very good not only to give information or to teach or educate the doctors, but we need to educate all the people who needs to work with the patient. Let's say nurses, pre-hospital care, also the people who are involved in medical decisions in the hospital, in the management. Because if they don't understand how important it is to do education, they are not going to help the people who are working in their hospitals to have a good education and to change the outcomes of the patients.
Okay. Dr. Jimenez, we need to take a quick break, but when we come back, we'll continue our discussion.
Thank you very much.
Thank you. Welcome back. We're continuing our discussion today with Dr. Maria Jimenez. And Dr. Jimenez, or Maria, you corrected me on that. You were mentioning some of the programs and the support that you would actually need in the hospital setting. And you alluded to the nursing being one of those support mechanisms. Are there rather specific programs that even nurses would be able to take in order to enhance their skills with regards to trauma?
Oh yes. So for doctors we have the advanced trauma life support, but for nurses we have the advanced trauma life support too. So the good thing, and this is very helpful, is like the course from the nurses and from the doctors come together. So they receive some information, some conferences, they receive a manual before, and for 2 days they will come together, receive this information, and then they will go apart to do some skills that are different from the doctors, that different from the students, from the nurses. So, and also that normally we do, let's say all over the world, in Colombia, in Brazil, is like the pre-hospital people can attend to, so and we can start to speak in the same language.
So you're saying, for example, if an ATLS program is going on, the nurses would be able to work along with the physicians in that program?
Yes, they can do it, and this has demonstrated to be very good for every single country and hospital, because you start to talk the same thing. So let's say there is new residents in your hospital, and there has been nurses that had been trained in trauma with the ATCN. This is the program for nurses, or they have been observers for the ATLS. This is the course for the doctors. And then when suddenly there is somebody who doesn't know, they teach them. They say, you know, doctor, probably you need to do this thing instead of that thing. So this is really, really helpful.
And I appreciate the point you're making as far as the inclusion, so that there's synergy and harmony between the team, the physicians, the nurses, all the allied health and ancillary departments coming together to work as a team. Is this what these programs actually promote, is harmony amongst all the healthcare providers and healthcare professionals?
Yes, yes. So let's say this is the interest of all the people who are involved in the trauma, that they speak the same language and they know which are the priorities. This is something very important about the treatment of the patient, because if they don't know which priority goes first, people can die.
Exactly.
Let's say something that is happening when the people are not trained for that. So you see that there is a fracture, very bad one. So they start to treat the fracture, but they don't look into the airway and also to secure the spine. So if you do so and you start to treat something that is not something that is going to kill you, the patient is going to die. So this kind of education gives you the idea which is the priority to treat the patient, especially when they are life-saving procedures that you need to be done.
Do you find, or has there been anything published to show a direct correlation between the team concept and more of the individualistic approach to treating trauma?
Such as the team, I'm not pretty sure now. But let me tell you, so this is medicine-based information that the countries where they had been starting the ATLS program had a demonstrated decrease in mortality and morbidity. And the places and hospitals who are having these kind of courses, they are having better outcomes than the ones that they don't have. And also this is a great opportunity to teach all our future doctors. So what I want to have the most, let's say, I work in a teaching hospital in Colombia, is like the day that I'm going to I hope not, but if I have an injury from a motor vehicle crash, I will have somebody, a doctor, who's going to take good care of me, or my kid, or my grandmother, or my mother, or my husband. So this is something that we need to work very well, because in the future you can have trouble.
What about the argument that, oh, I have ACLS, I have advanced cardiac life support, I don't, or one will outweigh the other?
Okay, so no, you need to have ACLS too, because this is something for a very important diseases such as cardiac attacks. And I think people who work in the emergency department, they need to have ACLS, of course. But the ATLS is completely different from the ACLS. The priorities are completely different. So for the people who work for ACLS, if they go to ATLS, it's completely different. This is night and day. So you cannot say because you have an ACLS course, you can provide a good trauma care in your hospital.
Have you seen any statistics recently as it pertains to trauma in the Caribbean and how it falls on the, let's say, the top 10 causes of death?
Okay, so let's say for Antigua. For Antigua, if you put together injuries, other injuries, and motor vehicle accidents, this trauma can become the 5th cause of death. So it's something very important. It's following the 10 causes, and probably the people don't know. And especially because there are so many things that we can do as a prevention that you can decrease this trend. So why we need to go, so let's say we need to look after the people don't drink and drive.
Okay.
This is a very good example that how prevention can help to decrease this pattern.
And sometimes we look so closely at the chronic diseases that we fail to realize some of the other causes. And we will say that for good reason, a lot of attention has been placed on hypertension, diabetes. The number 1 cause of death here in Antigua and Barbuda amongst both men and women is heart disease. So obviously a lot of attention is being placed on that, but we can't ignore trauma. We're going to take another break, and we will be right back with Dr. Jimenez again.
Is he coming up?
Yes.
So, Maria, before the break, you were telling me about prevention, or we were talking about prevention. What are some of the preventative measures you think, even within our local society here in Antigua and Barbuda, that we can do to help reduce the incidence of trauma?
Okay, so there is a demonstrated relationship between drinking and driving.
Okay.
And I know everybody here feels like they are very close home. But one of the things that you can do, especially, it's like to say you designated a person who's not just going to drink just a glass of wine, and this person can drive you all safely. Or even better option is to rent a car with the driver, and is going to take all of you, all the party, all the people who are having fun and everything, and drinking, having fun as a friend, and then can bring you to your house safely. Because in that case, it has been demonstrated, let's say like in the States, as Virginia, when they did these kind of measures, the rate of mortality and accidents due to motor vehicle accident decreased significantly. So if you want to see your kid arriving safe at home, please tell them, designate a driver for this time, or rent a car with a driver and a taxi, or something that is going to feel like your mother is going to feel relaxed, because or the friends or everybody is going to be safe. So this is something that's very important.
Very good suggestion. So that's drinking and driving. Are there some other tips as well? Other areas of trauma that may arise?
Let's say in South America, there is a lot of people who are driving motorcycles.
Okay.
So when there is no law about there is no law at all telling that you need to use your motorcycle in a safe way, this is a lot of crashes and a lot of people who are dying. Let's say, for example, in Colombia, the mortality rate, it's mainly directed to homicides. But for point of view of motor vehicle crashes, the first mortality cause is to have the motorcycles. So we needed to improve our law for these guys to only have one line to go directly, because when they start to zigzag, this is the moment that they are going to be hit. So we need to take care of that.
And definitely helmet use. I remember.
Oh yes, yes. I'm right now, because the helmet use is very important in Colombia. But I know that the people from Argentina, they put the helmet like it was a purse. So
what's the point?
What's the point? So wear a helmet, and you are going to be safe.
Do you find a problem in Bogota with texting and driving as well?
Oh, but of course, yes. So this is something that you can do. Don't text. Now that we like to do Twitter, right, Facebook, and WhatsApp to your friend, you need to stop doing this, because it also makes that you are not aware of the rule. So this is something that is going to be a very important decision, that you need to do it. And probably there's not going to be a policeman every single time that you are going to do it, but you need to make sure that you are not going to do texting when you are driving. This is something that we need to stop.
Okay. Thank you for those excellent pointers. Thank you for taking some time to sit down and talk with us on healthy perspectives on how to be safe, but also some very informative information on various programs that maybe even here in Antigua and Barbuda we can eventually look forward to having, in order to enhance our streets, enhance the effectiveness of our emergency department and so forth as well. But thank you. Hopefully you enjoy the rest of your stay here at Antigua and Barbuda as well.
Oh, I will do it for sure. And thank you very much for having me here.
Anytime, anytime.
Thanks.
We'll take our final break and we'll be right back. Several years ago, while visiting a family member in North America, I myself was hit by a drunk driver. The guy was traveling at a speed that exceeded well over 120 miles per hour. After I was pulled from the mangled vehicle, the drunk driver himself staggers over to me and asks if I'm okay. The furious bystanders that came to my rescue answered for me that I wasn't so okay. Interestingly enough, after coming home to the Caribbean, one would think we could escape such incidents. But lo and behold, one day while traveling up Market Street with my son, I was again hit by a drunk driver. As he and his alcohol bottles fell from his vehicle, he asks, "Are you okay?" Deja vu. It is hoped that our episode today will help familiarize you with some of the measures healthcare providers should take in order to effectively care for and treat persons suffering traumatic injuries. It is hoped also that we leave you this evening with a renewed desire to be a bit safer in your day-to-day activities. The safety measures you implement in your daily life can help stop you and or others around you from falling victim to the deadly disease, trauma. Take care of yourselves. We thank you for spending some time with us and for allowing us to share healthy perspectives with you. Be well, Antigua and Barbuda, and may your perspective always be a healthy one.
Healthy Perspectives, an AUA ABS initiative offering you a positive view on health.